I'm Dr. Ann Webster, a health psychologist at the Benson Henry Institute for Mind-Body Medicine. I work with patients who have life-threatening illnesses. Their treatments aren't kind. Many of them are experiencing recurrences. Some have been told by their doctors their medicines aren't working and there's nothing more to offer them. So they've lost their hope. And they come to me in search of healing. I teach them mind-body medicine self-care skills. For some people, this trauma can actually be transforming. It helps them to find new meaning and purpose in their lives, a redefinition of the self. People's suffering also intensifies their sense of connection to family members, spouses, friends, caretakers, and community. It also makes people kinder, more empathic, more appreciative, compassionate, and grateful, and even spiritual. In my patients' stories, I often hear of acts of great altruism. This film is about some of my most courageous patients. They used mind-body self-care skills to help them cope, to make sense of what happened to them, to maximize their health, and to find hope. When you listen to their stories, you will realize that you are taking part in something that's very sacred and special. And you know what? They're inspiring. I had a wonderful Aunt Helen who was a fashion designer in New York City. My Aunt Helen was my family, my teacher, and my mentor. In the early 1970s, she was diagnosed with breast cancer and was hospitalized in Memorial Sloan Kettering. She told me that she never would have survived that hospitalization had it not been for the volunteers. So I decided that I would give back for all the help that they gave to my Aunt Helen. I went to Memorial Sloan Kettering and went through their training program to become a volunteer. I would go there at night after my regular fashion job. They might send me to see someone who needed to be fed or go see a patient who needed help writing letters. Often, I would push a cart in and out of each patient's room, providing toiletry items and magazines. I had never worked in a hospital before, and I found it absolutely harrowing. I'd step off of the elevator, and it was like being on another planet. No one on the floor had any hair because they were all going through chemotherapy. I would see people with horrible tumors and wonder how anything could get so out of control. I would see someone repeatedly, then one evening the bed would be empty, and I knew that the patient had passed away. My first 6 months of volunteering was really frightening. I would leave the hospital and go out toward First Avenue and almost cling to the side of the building to reach the bus stop. I was just shaking, and I've had nightmares about all of my hair falling out on the pillow. But the patients would tell me such incredible things, and I kept thinking, where are the people who are supposed to be listening to these stories? They could call in psychiatry if somebody needed meds, or request a social worker if someone needed counseling, but there was nobody to just sit down and talk with the patients. So after a while, I realized that I had a huge job there. I volunteered for several years, and it totally changed my life. I couldn't continue in the fashion business because it began to look so superficial. Who cares about a certain shade of pink or the length of a sleeve when people are struggling like this? So I quit my job with everybody saying, "Are you nuts? You're walking out of a job with a big salary? Are you crazy?" And I kept saying, "You just don't understand. You just don't get it." So I went back to school. I attended Albert Einstein in the Bronx and received a PhD in health psychology, and I've been listening to patients' stories ever since. As a psychologist, I listen to patients' stories all day long. Many of my patients have a life-threatening or terminal illness, so we talk about their medical diagnosis and the stories of their lives. I create a case history and interventions for their situations. Sometimes we come up with different endings for their stories by the time the patient finishes working with me. This is a whole area of medicine called narrative repair. And 10, 15, even 20 plus years later, these patients have defied the odds and continue to inspire me. I first met Ellen when she joined my mind-body cancer program at Beth Israel Deaconess Hospital back in 1994. She was 32 years old and had just been diagnosed with invasive breast cancer. This was a direct result of her treatment for Hodgkin's disease 10 years earlier. She was completely distraught and distrustful of getting any additional treatment, since this is what caused her new cancer. She ended up going through my mind-body program several times. Ellen has now had cancer 4 times and is still suffering side effects of radiation.
No, on Wednesday you're going to her real birthday dinner. She's not going to let you film her while she's getting dressed. This pumpkin face. I was doing a semester, my senior year of college, in London. Felt fine, felt great, except that I had this lump sticking out of my neck. And somebody else said to me, "What's that lump?" And I'm like, "Oh, I don't know. I was just playing with it." So I went to see a doctor when I was in London, and they said, "Oh, it's probably nothing. You're allergic to cats." Because they said it might be cat scratch fever or something. "We'll take it out if you want." And I'm like, I'm not going to have surgery in London. So I came home, and over Christmas break, I was done with my semester in London. I was getting my wisdom teeth out. So they just took this out of my neck at the same time. I never thought anything of it. Actually, when I went to the doctor to get my stitches out, he said, "Aren't you going to ask what it was?" And I said, "Oh, yeah." I had stage 3 Hodgkin's disease, which basically meant I had already spread all over my body, and I felt fine until they started cutting me open. And so it was, when I was 20 years old, it was sort of hard to imagine that I was sick. So I went on chemo. I had 3 months of chemo, 3 months of radiation, and 3 months of chemo. But anyways, I graduated. I came home. I spent the summer working at an ice cream store, and all my friends are moving out of the house. They're graduated, and I'm scooping ice cream, living at my parents' house, going in for radiation in the afternoons, and then being sick. It was a really crappy 9 months, 10 months. And I got better, and I lost my hair, and it was really, really short. But back in 1984, there was all those punk rockers. So I'd go to my friends in New York City, and they'd be like, "Oh, you'll be able to get into this club because you have this really funky hair." And I got a job in advertising, and everyone thought my hair was short just because it was in style. Although, no way. So I went on with my life. I did start doing fundraising and doing things with the Making Strides Terry Fox Run, and I started getting involved with the American Cancer Society. But I pretty much put that behind me and moved on and didn't really think about it again. And once a year or every 6 months, I'd have to go for my checkups, but it was out of my head. I was done. And 10 years later, as a result of the treatment I had, the radiation, I had invasive ductal carcinoma. And I'm sure they told me at the time that that was a possibility from the treatments. But of course, who's going to think that you have that? So I was going in for mammograms as part of the follow-up for Hodgkin's, and totally shocked when they told me, again, I felt fine. And I had this size, invasive ductal carcinoma, breast cancer. And that time it really hit me differently. I don't know if it's because I was 10 years older. I don't know if it's because I knew what was going to happen again, or because I knew that anyone I knew that had ever been sick, had been sick twice, didn't do so well. So I was really scared and really freaking out, much more than the first time. I mean, and I was angry. I'm like, the treatment caused cancer? Really? There has to be more to it. I can't just do what I did last time, because that'll just get me better. And I'm not very religious, but it's like someone's telling me you have to learn some stuff, or else you're going to keep getting sick. And so I had to take responsibility for my illness. Now, people will say, and as you've told me, oh, Ellen, it's not, you can't blame yourself. Well, blame is different than taking responsibility. And I allowed it to happen to me. It's mine. And I almost feel like I can feel empathetic with people that are alcoholics or drug addicts or other stuff, because whatever caused it, if I forget how to get rid of it, what I learned in the mind-body stuff, I'm going to keep getting it. And it's a shitty way to learn something like that, but I guess that's what it took for me to learn it. So I'm very thankful for my cancer for the second time. Not thankful for all the side effects that I'm getting later on, but as I told you, at least I'm here to complain about it. I don't even remember how I found you. And it's just like, I just remember sitting in your class. I think I took the mind-body class. I was the frequent flyer 4 times. Oh, basically it was the same every time, but I learned different things. And I remember thinking and saying, I can't believe I had to get sick to learn all this stuff. And sometimes to this day, I remember. When I'm sick, of course you remember. And then you forget sometimes. And then something happens, or you meet somebody, or you meet someone else that's sick. And then you remember again all the stuff that you learned. And then you forget. You just don't learn it, and then that's it. I think you have to practice it. Like just doing the relaxation with you just right now. It's like, oh yeah, I remember just hearing your voice. When I talk to you, I remember.
You just notice those thoughts.
And it's really been helpful for me in my life.
Back to your out-breath. Our society's become very, very technical. The more technical we become, the more isolated we are. We sit in our office cubicles looking at screens, cut off from face-to-face contact with people. We're separated from stories and the touch of others. And we're bombarded with so much information we don't know what's important and what's not. So people are yearning to hear stories and to tell them.
So the center inner circle is made up of my family, my marriage to my husband, my 2 children, and my parents and sister, and then my girlfriends, both close in town and far away. And sleep, because I'm a sleep researcher, and also because sleep is a very important and resilient part of my life. And then also the Benson Babes. So here I have MGH Benson Henry Institute, and there's a picture of me wearing the coat that week.
Great.
That I took a walk outside.
So I wore the coat on a pretty, I would say, uneventful week. And by uneventful, I mean life is good. The coat for me represented the warmth and the hug from everyone in this group. And I had it with me at home, and I didn't have a scan, I didn't have anything major happening, but I needed a hug from time to time.
Yes.
And the coat was my hug. And every time I put the coat on, I felt the warmth of this group coming toward me. And I honestly wanted to keep the coat.
It's just wonderful. It's such a great idea.
You've never seen the coat.
Healing coat.
Yeah, Anne, put the coat on.
Yes, man.
You're gonna put some therapist dust on it.
No, your Home Depot.
Home Depot tools.
Looks good on it. Oh, look
I think it has to be. I think we have to have a scarf for spring. We have to have a scarf for spring.
We have to have a scarf, guys.
Yeah,
Yeah.
we gotta get a scarf.
I first met Rob in 1988 when he participated in my Mindbody HIV and AIDS program. He weighed 90 pounds. He had no T cells left. He was going blind because of CMV retinitis, and the nurse had told his parents to get hospice workers in. After the group ended, I lost track of Rob, and I assumed that he had died. In 2011, I was at a board meeting for Community Research Initiative, which is an organization that does AIDS research in Boston. I was leaving the meetings, and I looked into another room, and there was a poster up on the wall. And it was a poster of a man standing on a bridge. And the caption below said, "Volunteering for HIV drug trials saved my life." When I inquired as to who this guy was, I was told that it was Rob Phelps. And I asked, well, when was this picture taken? And they told me it was a couple of years ago. I was shocked that he was alive. I knew I had to find him. So I called every gay man I know. I told them to look in P-Town all over Boston, somebody find Rob Phelps, and we did.
Well, when I tested positive for HIV, it was totally unexpected. I remember that I had just graduated from college, and I didn't know what I wanted to do. I mean, the whole world was sort of out there, and I actually had landed a pretty great temp job at Harvard, and within about 6 months, they asked me to work there full time at the law school, which was actually a really great place to work, as it turns out, if you want to work there. And so I had a great job, but I wasn't sure that I really wanted to stay at Harvard. And I had friends in San Francisco, and so I thought maybe I might want to move there. So I got tested because at that time in the late 80s, as a young gay man, that was what the responsible thing was to do. So I went and I was tested, and I was completely surprised that I was HIV positive. I think I blamed myself because I had experimented as a gay man a little bit when I was in college. I'd had a few flings, and they were really mild. By that time, the news was out of the things that were safer to do and the things that weren't safer to do. I read my Bay Windows newspaper every week and, sort of caught up with what I was supposed to be doing and thought that I was doing everything that I was supposed to. I was trying to be the good gay man. And what actually happened was a complete surprise. My life was going to be completely different than I ever thought. My first thoughts were, what am I going to tell my family? How am I going to tell my mother and father who didn't know that I was gay? How was I going to tell the people that I worked with? In fact, was I going to have a job after I told them? These were all the practical things that sort of just were swimming around in my mind. I remember there was a nurse there who gave me my results. She was wonderful. She said, take a deep breath, which I did. And then she said, tell yourself you are good 10 times in a row. And I thought, my first thought was, well, this is so ridiculous. I mean, what a silly, thing that I have to do. And then I thought, well, my gosh, that's what I had been trying to do all along, be good. And so the second time I said I was good, the third time I said I was good, I started believing it a little bit more. And I just kind of like, all the old feelings of the things that I had done well just sort of came back to me, whether, not memories in particular, but I could walk out of there and I could feel like something different was about to begin in my life, and I didn't know what it was. When I started developing symptoms, I found a really good doctor. I did not move to San Francisco. I kept my job at Harvard, and I took full advantage of the wonderful medical care that they had there. Students were always complaining about the infirmary. I thought the infirmary was the greatest place in the world. But there was only AZT at the time. And so I've shot through that probably in about 6 months. T cells started to fall again. We found another therapy. A drug would come out, a new medication would come out maybe every 6 months, maybe every year or so. We would try it. We would just just hit me with it as hard as possible. The symptoms were horrible. I mean, some of the pills were enormous. They were like horse pills, and you'd have to take 6 of them in the morning on an empty stomach. This is part of the reason why I lost so much weight, because I developed AIDS-related cachexia, it was called, and it's basically the same thing as anorexia. You look at food and it looks like a brick. That's when I started really taking control of things, and that's around the time also when I met my partner. And I told him on our second date that I was HIV positive. And he, took like about a week to think about what he wanted to do, I think. And I don't think it even actually took him that long. He called me right away and said that he was gonna be in, it didn't matter, that he would continue. He didn't know what he was getting himself into at all. But, I've been very fortunate in a lot of ways. I didn't always realize that at the time. The decline happened pretty quickly, but I kept, taking the medications, and my partner kept propping me up in his Jeep and saying, we're going hiking, we're going skiing once even. This is as I'm down to like 110 pounds was probably about the lowest I think I weighed, normally 160. So I went to your group, and I had heard, I believe from my friends at the support group, that it was really hard to get into, that it was the group that you wanted to be in, and that there was a long waiting list, and you might not be admitted for one reason or another, and you had to go and you had to meet you. I had to go and meet you and, basically be selected. And I was terrified. I was absolutely terrified of you. You might, this is my only hope, and I had gotten behind it. I thought, I'm going to learn how to meditate, and I'm going to get well this way. I also felt this wonderful calming feeling in your presence. And I felt that even if it's bizarre, but even if I didn't get into your group, at that moment when I was sitting there, I sort of felt like I'm going to go to the right next place, wherever that is. So I just relaxed and talked with you. And, of course, I got to the group and I found this incredible feeling of fellowship, I think. Everybody wanted to live. Everyone in the group, and there were people in very bad shape, much worse shape than I was. They just were living in the moment. I mean, they were just happy to be alive, and some of them were dragging themselves in there, the way I used to drag myself on a hike. I mean, here they're dragging themselves to the hospital. I showed up every day. I did my homework. I read your book. I learned to meditate. I just relaxed. Well, I didn't start doing the drug trials until after I had done your workshop. So the altruism, I think it was really, it was just fighting to stay alive. I wanted to get on these drugs. I wanted to get on the new meds that were coming around the corner. Now, I knew not all of them worked, and a lot of them had surprising side effects. As a consequence of one of them, I lost the sight in my right eye. I went on to a med that was actually an oral version of the of what before was only administered through a catheter in my chest, which I had to do for 4 hours a day. The new oral ganciclovir came out, and I thought, great, I'll give this a shot. And within a couple of weeks, it didn't work, and I went blind in this eye. So I went on a different medication. But I have to say that at such a young age, too, I felt like I wanted to do something to contribute before I died. And the worst possible thing that could happen from these trials would be me dying, but a study having been complete, and they would know a little bit more about the research. So I felt like it was just, it was a privilege to be able to do the drug trials. It was a privilege to be able to contribute in some way. So many people were just blindsided by AIDS and never had an opportunity to do anything. They just got to get sick and die quickly. And I had this opportunity now to do this. And I was also sort of filled with this idea of embracing life that I sort of had developed during the weeks that I was in your workshop. I went back and got my graduate degree. I went and got a degree in creative writing and Master's of Fine Arts degree. And I wrote my heart out in that college application. And I was reading books at that time. They were just, I was feeling everything just so much more intensely than I ever had before, because everything mattered. And I think I've held on to that. I think that's the biggest sort of gift from this experience that I've had, this kind of journey through AIDS that I never wanted to take. But from this experience, I think that I do see that every day matters, that I'm so fortunate to be living in my 40s, moving into my 50s soon. You know, I was in my 20s and I was thinking I'd probably die. It would be good to live to 30. That would be really nice to actually get that far. My family would be happy with this, but I would be, delighted. So yes, I mean, the experience of being ill has definitely made me feel more responsible to try and live my life to the fullest. And it also just to sort of appreciate, I think, more, or to try to appreciate at least, what other people go through. Just sort of have an appreciation for all of life.
I first remember meeting Erin in her hospital room at Bethesda Deaconess, where she was hospitalized for a diagnosis of chronic lymphocytic leukemia. She'd had a bone marrow transplant, and the donor was her brother. The transplant failed. I was called in by a social worker to go to Erin's hospital room to teach her some relaxation techniques. She was extremely anxious. She was put on chemotherapy, which nearly killed her.
But yeah, I used the visualization techniques and the meditation that we did together a lot, especially in chemo. And before my transplant, I did 3 days of full body radiation. One of the days was my 31st birthday. That was kind of tough telling the lab people, oh, today's my birthday. But yeah, I did a lot of just kind of closing my eyes and visualizing the chemo. I pictured it as sort of like cells attacking my leukemia cells, and pictured myself having, a warm core and a healthy core and really healthy red blood, not that ashy black stuff that they had taken out of my bone marrow before. And after so many chemotherapy treatments and full body radiation that was to set up for the bone marrow transplant. And part of the treatment is that you're in an isolated room. It's like a clean room, and you could be there for up to a month. And I was there, I think, like 26 days. So you're in the room, and there's a big cart with medical equipment and a big metal cart that comes in your room, because nothing can be brought in outside the room that's not, wiped down and disinfected. And everybody who comes in the room wears a surgical mask and wears a gown, to come and see you. And this is the room where, after you get the stem cells, you get really sick. I mean, just constant vomiting, diarrhea, just being depleted completely. And it's basically, you feel like you're going to die because you're so sick. The physical part ends, right? You're healthy. You go back to school. You go back to work. Your whole life is staying alive. And you're in an office. It's like everyone says, "Oh, good, glad to be back." You're like, yesterday, my life was completely different. And now I'm in a cubicle, But the emotional part and the healing that goes on takes longer, because you have your own mental issues to deal with. I mean, I had to go through 2 bone marrow transplants in a year. I had a great start, and then it failed. And what did that mean? Then I had to do it again. No, you go through 2 bone marrow transplants. That's a lot. And then I met people in the hospital, young people. They had multiple bone marrow. Their whole life was bone marrow transplants to stay alive. Is that right? I don't know. But I was like, oh my God, when this happened to me again, is that going to be me? Is that the life I'm going to have? But the mental part is definitely, I found that it just took a long time to feel like, you know what, it's going to be okay. I mean, every little thing, a little thrush in my mouth, this is it. It's going to happen again. Or, feeling tired. What did that mean? And it just took a long time to have faith that this happens to normal people too, Thinking positive was a major part of how I dealt with it. And with, help from you and the meditation and visualization and all the books I read. And I think too, it was the only way I could deal with it. I couldn't let my mind wander into the negative. It was too hard. Every day was the battle. And I had to have my head straight. I had to be, on my best. I had the game, I had to be in the zone every day. I was, I couldn't let my guard down. I couldn't let it take over me mentally, because physically it was hard enough. I couldn't go there. I couldn't even really think about the weight of the situation. It was the only way I could really cope with it, is just to say, all right, I got to put that aside for now, because right now it's about the physical. It's about making sure that when this chemo gets in me, that I'm focusing on that doing its job. I couldn't deal. It was too much for me. It was just too much all at once. So, I think that was one of the mechanisms that I used to help me just stay positive, because if I started thinking about how bad this was, it was too much, it was just be too much for me. So, between the first and second transplant, I took the class with you and all the other cancer patients. I think there was probably 25 or 30 people in the class. And there were some very sick people in that class. And I had gone through a bone marrow transplant and I had graft versus host, which presented itself on me with a skin. It looked like a rash, a really severe rash, head to toe. So my skin was very pink. And we tried steroid creams and steroids, and, nothing seemed to work. But I found your class very helpful because I could be in a room with people who, some people were doing well. Some people were much sicker than I was. But I felt, again, a sense of a community, with the survivors. And, it's sort of a membership you never want, but once you're there, you're a full-fledged member, And, it was a way at that point I felt comfortable I could start working on that mental part. And how do I deal with this, the enormity of the situation? And I know I've mentioned to you before, I think that some of the things that you taught in that class, is applicable to healthy people, and just to try to get your mind right and like you say, meet the day and, have that set of tools that you can go to when the time is right. If not every day, I personally pick and choose. Those times when my mother would encourage me to meditate and think positive, and I was too cranky, I was too pissed off, I couldn't do it. I didn't have that serenity at certain moments to go there. I couldn't. I was just, especially the second transplant, my attitude went from extremely positive to I was pretty upset. I was angry, and because I think that I just felt like this isn't fair, I didn't feel that the first time. I didn't feel a sense of what was me, why me. I just was like, okay, we're gonna get through it. I never felt like, geez, this is not fair. The second time I felt like this isn't fair. Maybe because I felt like I did everything I was supposed to do. I was positive. I was feeling well. It was working. And then it wasn't working. Then it was like a big, doesn't matter, does it? So that was harder for me second time. So I was really sick. I had a fever for 2.5 months. I didn't know why. Didn't know if I was ever gonna overcome the fever. Some infection. Didn't know why my counts dropped. Couldn't answer that. I wasn't mad at them. I just mad at the situation. We don't even know. I mean, I was so careful. I didn't take risks. People email me now, oh, I heard you went through it. I go out without my mask and gloves. I go out of the house. I didn't do any of that. I did what they told me, and I still had to do it again. This was like kits for changing the port, the Band-Aid around the port.
Yeah.
So I had 4, not all at the same time, but they kept getting infected, so they'd pull them. And so these were... Oh, this is for when I had GVH skin protectant stuff. These are all swabs and rubber gloves.
So you saved all of this just so that
I don't even know why. Like, partially, here's some masks.
pull out one of the masks. This is just like, this is like.
Mask and gloves. It's like,
So everybody who came in had.
every time I left the house, I wore a mask and
You'd have to
gloves.
have one of these on.
Yeah. Mask
Like
and
this,
gloves. Yeah.
Everybody who came into your world is like this.
Yep, and every time I left this world, I had to be like this out in public. Take a walk around the park, I put this stuff on. If I'm by myself for a while, it gets to me because, and I can, when people call me and they say, Erin, somebody I works with, brother or sister's been diagnosed with cancer, what can we do, and I get calls all the time on my cell phone or emails, or can you talk to this person? What should I do? And I say just, treat the person like how your mom would treat them. If they say, oh, I don't want any attention, don't bring me anything, bring them over, a couple of movies and bring over some soup or something. Just sit with them. Just check on them. Come visit them. It's such a lonely, it's a lonely experience, you know?
Stress is a major feature in health and well-being. In fact, 60 to 90% of visits to healthcare professionals are caused or made worse by stress. Yet there are no effective drugs or surgeries, procedures that will counteract its harmful effects. Fortunately, we have within us a reaction, a response opposite to the stress response that's called the relaxation response. And when that is brought forth, changes occur in your genes' activity that are opposite to those of stress. But it comes at a price. In other words, although it costs no money, it does cost the time it takes to sit quietly or do an activity that evokes the relaxation response for 10 to 20 minutes once a day, because it's that 10 or 20 minutes that helps change your gene's activity in an appropriate way. Dr. Webster and I are delighted with these histories that describe how, along with evoking the relaxation response, these people have altered their illness. And we're delighted because the bringing forth of the relaxation response also quiets the mind, and it opens the minds to new suggestion. And Dr. Webster's teachings can occur after you evoke the relaxation response with the mind more receptive. It's more of an open door. So her work with cognitive restructuring, rethinking situations, her work describing spirituality, her work describing positive ideation will have more impact.
I first met John through some of his patients in 1988. John is an infectious disease doctor, and I had started the first MindBody HIV/AIDS program, first one in the country. John and I shared many, many traumas because for the first 5 years of HIV and AIDS, we lost all of our patients. John then came to see me as a patient when it was discovered that he had kidney cancer. He's right now waiting for a kidney transplant, but in order to have that, he has to be cancer-free for 2 years.
I started to get pain on my right side. I said, this is very odd, and I thought I just pulled a muscle or something. And then I had this terrible urge to urinate, and I went to urinate, and the toilet bowl filled with bright red blood. Cancer was as far away from my mind as you possibly could imagine. You and I go way, way back into the early days of the epidemic. I never knew you personally, but a couple of my patients found your mind-body workshops, and they found them very, very useful. Now, these are the days even before AZT, and people really had no treatment. And it's amazing to me how they got through that. And it was certainly a lesson for me with my own illness. And a lot of them went to your mind-body workshops, learned how to do the relaxation response, and found it very, very helpful. I saw you from afar at one of our first AIDS meetings, our local AIDS meetings, and we actually sat together one day and we chatted real quickly. And I just thanked you so much for helping my patients, because you really had very little to offer. And it was so good that you had something to offer that was concrete, that was real, that made them feel better. And many, many years went by, and I was having trouble binding my anxiety as I waited for these tests, waited for these dicta that were coming from the doctor that were going to determine what was going to happen. And I thought I needed some help. And I was very impressed by what you did with my patients. So I set up a clinical session with you, and you taught me the relaxation technique. And I remember telling you that I was a colossal failure because I'm not very good at sitting down and relaxing. But one thing I was able to do was take the technique and use it before I went into procedures, before I had tests, while I walked, and my mind would reel and I could just stop and take a deep breath and recall what you had taught me. And it was very, very helpful. I know. When you work here, all sorts of weird things happen.
Yeah.
But I think it's good. We have a 1 o'clock
I know, I saw your name on there.
and no blood,
No blood.
thank God. I even have a thingy from my CT.
Oh, do you?
Does that count?
Yes, of course.
Oh, good. This doesn't hurt at all. It looks like it should hurt, but it doesn't at all.
Is this a power cord?
Yes.
Okay. It is. And what side of your chest?
It's right here. Two questions I get a lot. Is being a doctor helpful in this? And that's another wonderful question that doesn't have an easy answer. I think in some ways it does, because when they tell you you're going to go for an ultrasound or you're going to have a bone scan, you kind of know what that is and you kind of know how to prepare yourself for it. But on the other hand, I know everything that can happen when they come with a treatment and they tell me they're going to do this. A list of things go through my mind. And my training, of course, is always to think the worst, because that's my job, to help people get through the tough things. So I didn't have a great feeling about dialysis or a great feeling about chemo for myself, because I knew what people went through with this. So I think it's a double-edged sword. I mean, a part of it is easier because the hospital is not a mystery to me. I know how hospitals work. I know the nurses and the physical therapists and the nutritionists and the social workers and the medical students. I know the whole family and how all that works. But on the other hand, I also know all the bad things that can happen to you. This infusion port goes pretty close to your heart. And so they have to be very careful not to produce any infections. Another question I get is, how do you handle this? How do you get from day to day? How do you, knowing that you have this awful disease and your life can turn on a dime, how do you go from day to day? And how do you handle life's trivialities? I think the way I get through it is two things that you and I have talked about before. One is I came out in medical school, which was a very tough thing. I almost left the practice of medicine because I couldn't figure out how to be gay and be a doctor and how to be doctor and be gay. It just seemed like the roles were very conflicting. But then the AIDS epidemic kind of salvaged me and galvanized me, because it was a way for me to be gay and be part of the community and give something back to the community, and at the same time do a part of medicine that was fascinating and real and something that you wouldn't want to pass by ever in your life.
So.
Hi, you have a whole crowd here.
That's right.
And I'm Ann Webster.
Hello.
I work at Mass General,
Right.
and we're working on a documentary, and John is one of the
this is
people in the
Riley.
documentary.
Hi there.
Here.
It is.
Oh, look at the smile! Yay!
Well, I think so. We'll have to wait.
You have to wait for the official
radio.
reading, but that's good. Come on in. It was very hard for me near the beginning to become a patient. Very hard. I wanted to control things, and I wanted to be involved, of course, but I had to let the control down a bit and let my doctors do their job. And that was a really hard thing. But once I learned how to do that, I could put my own 2 cents in, and of course I was going to put my own 2 cents in. There was no question about that. But listening to my providers and letting them do their job and watching their skills. They're not the same as my skills. My skills are different. They all have their own unique skills. But watching them do their craft has been one of the most wonderful things about all this. I mean, I used to remember seeing that with my AIDS patients. When when a patient got cancer and had to have an oncologist, and the oncologist came with great skill and great warmth and great care to take care of the patient. But to see it in my own life is just wonderful.
Oh my God.
We should line up for hugs.
It's like, absolutely.
Not only is James my dialysis partner, and my life depends on James in a very physical, real way, watching my needles and taking my blood pressure and taking my temperature, which has changed our life and our relationship completely. This is our home dialysis machine, and basically the machine is, we open it up, and this cartridge here, which has the artificial kidney and all the wiring and cabling that we need to do the dialysis in this cartridge. And I do this 6 out of 7 nights. And it has been an absolute gift to be able to do this at home. I used to have dialysis in the hospital, and you never really feel totally good. They do it 3 days out of the week, and usually the first day of dialysis, you're all bloated and you don't feel good, and then you go have dialysis and you come out and you're kind of tired and you're wrung out like a sponge. But by doing it 6 days a week, you feel much smoother. It's more natural and more normal. Okay, the way it works is that I have what are called buttonholes. I have 2 sets, an arterial and a venous. This is set 1, this is set 2. And I alternate between the sets. And it turns out that I take one of these needles, and I've learned how to do this myself. You would think that I would know how to stick a needle, but it's much harder to put it in yourself. But these are needles that are blunt on the end. And what you do is I get myself in a position, and after sterilizing the site, I just put the needle into the buttonhole. It doesn't hurt. You can see that the needle is blunt. It's not as sharp as a regular needle. And I've made these tracks, and it's just like a track where you would put an earring in. And it just slides right through the skin into the vein. It doesn't hurt. And then I do the dialysis. The blood goes through the artificial kidney. The bad blood goes by the dialysate fluid, which is hooked up there, and it cleans the blood, and I come out feeling refreshed and wonderful. It couldn't be better. This is probably the most important picture in the house. This is when James and I got married here in Massachusetts. This is on our 20th anniversary to the day, and we got married here at the City Hall in Boston and Newton, and it was just absolutely wonderful. Every time I get my blood drawn, it hurts James more than it hurts me, because he's right there, 190%. And it makes me sad, though, to think that I'm going to leave him and Lucky. That someday they're going to go for a walk without me. And I think about that. You know, what is it going to be like when they go to our park where we play kickball now, and Lucky jumps on the ball and is so excited? What is it going to be like when I'm not there? Are they going to go play ball? I hope they do. I also hope that James, if the time comes and the right time comes, that he can have another relationship, I hope. It's just, I don't like to think about it, but you have to. We had to think about my burial instructions, you know, where my ashes were going to go, where I was going to be buried, and all that. And it was really painful for the 2 of us. But we did it, and we got it over, and it's written, and it's gone now. We don't think about it. So we're in the job now of living life and keeping healthy.
Now, I could stand here from now until next Monday and tell you stories about what people have done as a result of this exercise. But one of my favorite stories was a 92-year-old man in one of my groups, and he's listening to people talk about There are pleasures of volunteering. One of the things I love about working in groups, I am working with people who have so many common threads, and they come together and they tell each other's stories, and they discover that they're not alone in what they're dealing with. That's one of the reasons I'm just so passionate about the work I do. Stories connect us to each other. Stories also inspire us, and I tell stories as a teaching tool. I tell stories to inspire other people. If another person could do something, then I can do it too. I want people's stories to inspire others who are going through the same difficulties. So people make incredible changes as a result of setting goals for themselves. Frank first came to me after being diagnosed with head and neck cancers. He was in very bad shape after completing 3 aggressive rounds of chemotherapy and 42 treatments of radiation. Frank was told he had only a few months to live. He was in desperate need of help. He eventually went through my mind-body program 3 times. And like many people, Frank's marriage and other relationships were pushed to a breaking point after he became ill.
I'd like to open this meeting that we have with a moment of silence and then read our little starter. In the year 2004, sometime around January, I discovered I had a little lump on my throat, actually right on my neck. And I could feel it. It was kind of a solid lump. I didn't know what it was. So I went to the doctor, and he thought it might be a cyst. So he gave me some medication. He said, you know, it should clear it up. And after about 2 weeks, I noticed I still had the lump. And I called the doctor. He said, well, it usually takes a couple of weeks to clear up. And it hadn't. So he sent me to have a biopsy. So I went to a clinic over in Salem, and I had a biopsy done. I had no idea what that meant at the time. And I just went about my normal life. I was exercising all the time, living life, had 2 little kids. My son was 9 months old, my daughter was 2, and just enjoying life, working. And I was at Starbucks at lunchtime, and I was having coffee with a friend, and I got a phone call, and it was the lab. And the lab said to me, it's malignant. Just like that. Which I didn't really, I kind of knew what that meant, but I didn't really know the ramifications of it. And it was kind of a life-changing call for me. So when I went back to the doctor, who sent me to a specialist in Salem, at Salem Hospital, and he kind of gave me an idea that we had to cut this out and do this, and it just didn't sound good. And he mentioned cancer, and I thought maybe I ought to go into Boston. So I ended up at Dana-Farber shortly thereafter, and they did a bunch of tests and re-examined the biopsy and found out that I had 4 tumors in my, three tumors in my neck and 1 in my throat. And that the primary tumor was in my throat. So they discussed with me what that meant, what options I had, and they said it was stage 4 cancer. And that if they treat it, it would be a very aggressive treatment, which I didn't know what the word aggressive meant at the time. But they set me up with a treatment plan, which consisted of 3 rounds of chemotherapy over a 9-week period, 42 treatments of radiation after that over 6 or 7 week period, and then followed up by a radical neck dissection. And I know at the time I was really lost. There were times where I would just go out and ride for hours, and I couldn't understand what was going on. The underlying thought was, I didn't want to leave my little children. Sometime after the radiation treatment and before the surgery, my sister took me to this mind-body medicine program where I met Dr. Ann Webster. The program was a 12-week program of different ideas on mind-body medicine, but one of them that sticks in my mind very clearly was, what are the effects of stress on the body? And what does stress do to the immune system? So I went to the classes, and I met approximately 15 people in each class. And I went through this program for that first 12-week period. And I was exposed to different forms of mind-body medicine practices. And what I found was the people that came to that program were the first time they were involved with people in that type of setting. And what happened was it created a bond. I mean, I could see everybody was getting tremendous help because, everybody was facing some type of, life-threatening illness, and now they could talk about it in the gentle manner that Dr. Webster had to alleviate a lot of the fears that came up with having a life-threatening illness on a daily basis, sometimes on an hourly basis. We found ways to deal and cope with that. And one of them that I remember was mini meditations. Sometimes you could be just waiting for an elevator. Close your eyes and just meditate for a minute. Stopping at a red light. They sound like such simple things, but when my mind used to scream, literally just jump right out of my head. I was in such terror on occasion, and it would just come on me. I remember one time just driving up the highway. During this first few months I was sick, I was driving up the highway, and I called my friend Ed, and when I went to speak on the phone, I couldn't even get the words out. I was just terror in my voice. I couldn't even tell him where I was. And finally calmed down enough to tell him where I was on the highway, and he actually came and got me. That type of terror I had never experienced. And to be able to deal with that and to find ways to deal with that and to talk about that with people. I didn't even want to face it myself, talk about it with myself, never mind discuss it with anybody else. But to find people and to be able to be in a setting where other people are experiencing that had a tremendous impact on me and help on me. I was fortunate that I had been in group settings before, so I kind of knew the value of being with people. But there were people that had never been in a group setting that were amazed that you could get this kind of help by just sitting and talking. After I did it the first time, I repeated the program, and I was sharing all the things I was doing. I was doing everything possible so I could stay alive. And I was sharing that with the group. So after the second time, and again, meeting another 10 or 12, 15 people, feeding off their energy and vice versa, I went through the group a third time. I just found tremendous value in it. Being in there for a while and realizing that people that are sick, I found out it's not always the people that are closest to you that you can talk to. In my case, I found that out the hard way. How you doing, my friend?
Not too bad, yourself?
Good. Well, the whole of Back Bay in Boston was filled in land. And during the big dig in the 70s and 80s, due to the construction, the water table was lowered. And all the buildings built in Back Bay are built on these wooden piles. When the top of the wood pile was exposed to the oxygen, the wood started to rot. And the buildings, which now sit on these wooden piles, are all settling. And the settling is causing cracking in all the masonry above it. I had lost my confidence in a lot of things, but one of them in the building trade that I was in. So I wasn't quite sure how I was going to do with it. But after building the first house, and then 3 or 4 more, I started to progressively get my confidence back. And then one of the fellas in my men's group that I've been involved in for years is also a builder, and he introduced me to an owner of a company who I interviewed with and hired me to work for him as a construction manager. We were building these mega homes, $20 million homes, $45 million homes, quite interesting projects. From there, Ken put me in contact with another company, which for the last three and a half years, I've been working as a construction manager with them. One of the things that was most remarkable for me in my cancer treatment experience was the people that showed up for me in my life. I found out what type of friends I really have. One friend in particular, my friend Ed, who I've known over 30 years, beautiful man. He took me to every chemo treatment, every doctor's appointment. He would come, pick me up in the morning, drive me to Dana-Farber, just sit there and read, sit outside while I was being treated, 8, 10, 12 hours a day, and then just take me back home. And he did this relentlessly the whole time I was in treatment. And I never knew this for a couple of 3 years later. He never said a word. He just showed up and took care of me, took me to treatment. A few years later, I found out that 15, 20 years prior to that, he had the same experience where he took his wife, his first wife, to the same place, a floor below, for 18 months. And one day, she died in his arms on the 9th floor. And he never said a word to me. Just a beautiful, beautiful friend. I've been studying martial arts since I was about 20, 21, 22. I got into Taekwondo. I was around 25 years old. One of the reasons I wanted to study martial arts is I watched a lot of kung fu films. And I saw different actors, Bruce Lee being one, doing all sorts of acrobatic Taekwondo, karate type kicking and punching. But more importantly, I did it because I wanted to defend myself. I came from a violent background, and I needed to defend myself. And as a young boy, I couldn't do that because I was too small. As I grew up and got a little older and lifted weights and started boxing, I was able to do that a little bit better, but I always wanted more. And Taekwondo was a way that I thought I could do that. Interestingly enough, I found out once I started studying that there's absolutely no reason to fight. And since I've been studying Taekwondo, I don't think I've ever had a fight, other than at the dojang where you spar. So I've been involved in this one particular Taekwondo school for 30 years. It's a mind-body spiritual practice. You develop your body, you develop the tenacity to stay with it. Has helped me when I needed it most. In 2003, I had taken my black belt test, and I passed the test, but during the course of the black belt test, I blew out my knee. So I had my black belt, but because I couldn't walk, I didn't want to put it on. I didn't want to go to the ceremony, have the black belt handed to me. So I waited a year. It was a year rehab, and I worked out very diligently with the rehab and got my knee back in shape. And it was just about a year to the day where I found out I had cancer. So I worked out for another year, and 2 years ago, retested, and was awarded my black belt. Something I'd worked 30 years for. And I'm very proud of that accomplishment. And grateful that I was given the opportunity to study at what has been ranked as the best school in the world. My advice for people with cancer, first of all, get an advocate. This is something that I never knew about, but get somebody that will speak to the doctors on your behalf. Because I noticed when I was going through all the exams and when the doctors talked to me, as soon as they said a key word like stage 4 or aggressive or growth, my mind would shut off and the terror would enter and it would blank out my mind. So my friend Ed was my advocate, and my sister, Melanie. My friend Ed would attend these doctor's appointments and write down everything the doctor said and interpret it to me later on when I could hear. Sometimes it was an hour later, sometimes it was a day later. The other thing I would suggest is try everything. Try everything. Don't leave any stone unturned. Go for all the treatment at the hospital office. Go for all the alternative medicines. It's so powerful. And never, 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 never give up hope.
In one of the sessions of my program, I asked 3 questions. What is hope? Where do you find hope? And how do you know when you have hope? And this is one of the responses. I was diagnosed in October. In November, after surgery, I watched the leaves of the maple tree turn a particularly fiery shade of red, then twist in the wind and fall. Still, as my body healed, hope shone brighter than fear. During chemo, on the good days, I learned to accept the small blessings of any given moment. In December, January, and February, hope became a walk around the reservoir, a cup of tea with a friend. Throughout the long winter, however, a certain kind of hope made me angry. A smug, too easy, power of positive thinking hope. A mantra chanting, every day I'm getting better and better hope. Because on the bad days, I couldn't skip the lamenting and the cursing because I was pissed. And couldn't pretend that the book of life is a little golden book instead of one filled with cold and hunger and cancer and what was there every day in the morning paper. In March and April, starting radiation, I began slowly to reclaim my life. I had been given another chance for however long. I drove to the hospital and saw each morning outside my windshield the trees starting to blossom. And when I looked inside, really looked now, I understood what hope is. Living each day with passion and attention, pursuing what gives my life meaning, devotion to those I love, causes I believe in, creative work, everything I value, friendship, compassion, even indignation gives me hope. And every breath I take creates hope, and I only hope somehow to pass it on. Your left hand faces up, your right hand faces down. Hold on to your neighbor's hands and close your eyes. Become aware of the feelings of peacefulness coming from the hand on your right, coming from the hand on your left. Take in those peaceful feelings. Send out your feelings of peace to the hand on your right, to the hand on your left, and to everybody in the circle. Become aware of the feelings of care coming from the hand on your right, coming from the hand on your left. Take in those caring feelings. Send out your feelings of care to the hand on your right, to the hand on your left, and to everybody in the circle. Then become aware of the feelings of joy coming from the hand on your right, coming from the hand on your left. And take in those joyful feelings. Send out your feelings of joy to the hand on your right, to the hand on your left, to everybody in the circle, and to those of our group who are not able to be here today. And hold on to all of these good feelings till we're together again. I would often take my mind-body program on a retreat at a retreat center in Gloucester, Mass. At each one of the retreats, we would have a little memorial service for the men and women that we had lost. One of the fellows in the group had lived in Japan and knew how to do origami. So we decided that we would make origami boats. Mike showed up with shiny paper, and each one of us made an origami boat for someone that we had lost. Then we got into cars and went to the sea. It was 9 o'clock at night. We put a votive candle in each boat, lit them, launched them into the water, and as we did this, each one of us said the name of someone we had lost. It was so emotional. We were standing on the shore crying and hugging. Here were our friends that we had lost, forming a circle, and they were taking care of each other.
Everywhere you go, come on, let it shine. Yeah, Lord, everywhere I go, and you come on, I'm gonna let it shine. Yes, let it shine. Let it shine. Let it shine. Glory, glory. Come on, hallelujah. Yes, since I left my burdens down. Glory, 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 glory. Hallelujah. Hallelujah. Since I left my burdens down.